Heads up, this podcast isn't therapy. It's bold, blunt, and irreverent, but it's not a substitute for professional help. Full disclaimer is in the blurb below. Okay, so confession time. The first version of this episode, whoa, it was a bit of a well-intentioned mess. I was overly ambitious, underslept, and clearly thought that I could cram a 5-part monologue into one breathless episode. But hey, sometimes I forget that I'm not auditioning for a TED Talk and a spoken word poem at the same time. So hopefully you'll find that this version of this episode is clearer, calmer, and yes, it's probably still a little chaotic because sometimes so am I. I am a psychotherapist who can write scripts at midnight. Sometimes when people cancel a session, I edit with espresso, and occasionally I forget that I'm not broadcasting from the inside of my own head. So welcome back to Psyche Cycle. Hopefully take 2 will be better. Let's make this make a bit of sense together. Right, so, okay, full disclaimer, this is for educational and informational purposes only. This is not medical advice. You're responsible for your own health. Please consult a qualified medical professional. I'm not advocating for any one treatment. I'm literally simply going to explain various options to help you make informed choices. If something resonates here, find a really good doctor to talk it through with, a really good consultant. There are wonderful people out there who can help you. Okay, let's get to it. Okay, at certain times of women's life, they think they're going crazy and they're not broken, they're not imagining it, and no, it's not all in their heads. So if you've been told you're depressed, anxious, lazy, attention seeking, fragile, or just too much, when the truth is your hormones are quietly steering the wheel, this series is going to be for you. So I've sat across from thousands of women in therapy over the years, women who came in thinking they were losing their minds, but who were in truth swimming blind through biochemical chaos. PMS, that was actually PMDD, postnatal depression that no SSRI could touch because it was a hormonal crash. And then women in their 40s on their 5th antidepressant when what they needed was iron, progesterone, or magnesium. Teenage girls mislabeled as totally over the top and dramatic when they were just biologically overwhelmed. And again, I've seen the same pattern. Symptoms misdiagnosed, bloods not run, deficiencies ignored, and women left to feel ashamed of what is actually chemistry. So this series is for every woman who's ever felt dismissed, for every woman who said, I just don't feel like myself anymore. For every woman who sat in a doctor's office desperate for answers and walked out with nothing but a prescription and a raised eyebrow. So I am a psychotherapist, yes, but in this work, I've also had to study biology, nutrition, do research, and advocate because nobody seems to join the dots. And I always encourage women to do their own research and refer. So now I'm just going to present the information that I've come across over the years here for you. So what will this series cover? Psyche Cycle will unpack the truth about the hormonal life cycle from puberty to menopause, PCOS, endometriosis, pregnancy, postpartum, perimenopause, and the mental health masks that they wear. We'll cover the relationship between low progesterone and anxiety, what estrogen actually does in the brain, why your doctor's blood tests aren't enough, and what you need to ask for instead. I'll cover nutrient depletions that mimic psychiatric illness and how to begin reclaiming your biochemistry one informed decision at a time. So we'll talk about magnesium, iron, B-complex, vitamins, zinc, selenium, the building blocks to your brain, and what your body actually needs to function because you're not underfueled, you're underinformed. So many women have lived this, and so many women have thought that they've been going mad. The private blood tests are accessible. Sometimes, yes, the public system will refuse them. But it's better to go private than suffer the exhaustion, the rage, and the not knowing. So no woman should be left in the dark like this. So this isn't a polished series. It's not sterile. It's not really that scripted. I bounce around a lot and I've tried to smooth it out for comfort. It's essentially voice notes from the battlefield. It's years of therapy room truth, conversations with beautiful women, and it's a conversation that I wish I'd shared with you all sooner. So this is just the beginning. If it resonates with you, share it with all the women that you love. It could actually, change so much for so many women. So, hormonal imbalance doesn't show up wearing a name tag. It doesn't tap you on the shoulder and whisper, "Hi, I'm low progesterone. I'll be your chaos today." No, it hides, it disguises itself, and more often than not, it gets misdiagnosed as a psychiatric condition or something psychological. So let's walk through this symptom by symptom, because if you've been handed a label that never quite felt like yours, this might explain why. So first we have anxiety, often labelled as generalized anxiety disorder or panic disorder, but it could actually be, depending on your stage of life, low progesterone, high cortisol, a thyroid flare, or estrogen dominance, all of which can put your nervous system into fight or flight, even if your external life is perfectly calm. Then you have the brain fog. This gets mistaken for ADHD, sometimes mild depression, but really it's estrogen decline, a sluggish thyroid, possibly poor methylation or detox pathways, and again, it could be blood sugar dysregulation. So this isn't a motivation issue. Your brain isn't lazy, it's underfueled, and no planner in the world is going to fix that. And then we have the sadness, tearfulness, emotional fragility that's often called depression, but underneath it, it might be a progesterone crash post-ovulation. It could be an estrogen withdrawal in perimenopause. It could be a postnatal drop, or it could be PMDD, premenstrual dysphoric disorder. None of these are character flaws, they're chemical cascades. And then you have the flat mood, the numbness, the apathy. It looks like classic depression, but it can also be estrogen deficiency, low dopamine, low testosterone, yes, in women too. Life hasn't lost its colour. Your biochemistry possibly has. Then you have the irritability, the rage, the snappiness, often dismissed as moodiness. In extreme cases, could be mislabeled as BPD, but biologically it can be post-ovulation progesterone drops, blood sugar crashes, estrogen dominance, or the wild hormone swings of perimenopause. So you're not dramatic, you're simply inflamed. Oh, and here comes the insomnia. People assume it's anxiety or overthinking, excessive rumination, but insomnia is also a screaming red flag for low progesterone, which is kind of like your body's natural Valium, cortisol dysregulation, or a disrupted estrogen-progesterone ratio. Sometimes it's not your thoughts that are keeping you awake. Again, it's your biochemistry. Then we have the fatigue, not this "I stayed up late tired" fatigue. I'm talking about bone deep, can't get going, can't get up fatigue. Drag yourself around. That kind that makes you think that something must be seriously wrong with you. It gets labelled as depression all the time, but it could actually be low thyroid, iron deficiency, B12 deficiency, low DHEA, or chronic cortisol depletion. You may not be lazy at all. You're more than likely depleted and running on fumes. So if your symptoms don't match your story, if the diagnosis doesn't fit for you, if you're doing everything right and you still feel really wrong, it might be time to ask a different question. What if it's not you? What if it's your hormones? So, when is mental health not mental and hormonal? Let's pause here on this because this next bit truly, truly matters. If you've ever sat across from a GP sobbing into tissues, describing your exhaustion, your anxiety, your brain fog, and left with nothing but a prescription for antidepressants, and I want to be clear, there are lovely GPs out there who just want to do something to help. Their hands are tied. Often they're not allowed in the public system to run full hormone panels. And I often have women kind of going, "They won't give me HRT." And I'm like, that's the sign of a really good doctor. If their hands are tied and they're prevented from doing their job the way they ethically see fit, there's no blame going on here. I admire that. I really and truly do. But when the chemistry of your body is off, when your hormones are swinging wildly, I also understand the frustration of the ladies that I talk to. And when your hormones are dropping suddenly or simply not keeping pace with the demands of your life, it can mimic every textbook symptom of mental illness. So let's break it down. Let's look at hormonal depression versus clinical depression. So hormonal depression comes in waves. It's often cyclical. It's tied to ovulation, menstruation, postpartum, or perimenopause. You might feel fine one week, then like a ghost of yourself the next. It can come with physical symptoms too. You may have intermittent breast tenderness, intermittent bloating, headaches that come and go, insomnia that comes and go, or cystic acne that comes and goes. So it often improves when hormones are supported. Then we have clinical depression. This tends to be far more constant. It doesn't fluctuate with your cycle. It feels like a fog that doesn't lift. It doesn't usually shift dramatically week to week without intervention. And here's the kicker. Most women experiencing hormonal depression get diagnosed with clinical depression and put on meds that might dull the edges but don't address the root cause. And next, I'll cover hormonal anxiety versus generalized anxiety. So, with hormonal anxiety, it often hits in the luteal phase, that's the 2 weeks after ovulation. You'll feel jumpy, panicked, or spirally for no clear reason. And it's often accompanied by insomnia, food cravings, irritability, and breast tenderness. It can also feel like you're vibrating inside your skin, but only at certain points in your cycle. And generalized anxiety disorder is very, very different. It's persistent and non cyclical. It's present across all times and situations, and it's often tied to unresolved trauma, an overactive nervous system, or cognitive patterns rather than hormones. And this distinction really matters because so many women are being labeled, medicated, and even hospitalized when in truth, their biochemistry really needs support, not suppression. And this is where biology enters the room. So if your moods change like clockwork, if it feels like you're on a roller coaster, if your depression comes with cystic breasts and sugar cravings, if your anxiety disappears on day 3 of your period, you might not be mentally ill at all. You may be hormonally depleted. And that's not something a one-size-fits-all diagnosis can fix. So next we're going to walk through the hormonal life cycle of a woman from puberty to postpartum to perimenopause and beyond, and I'll explain how each chapter writes its own symptoms into your story, because you deserve to know the truth about your body. So, to understand your hormones, you have to know where you are in the story, because your hormonal fingerprint isn't random. It's patterned, predictable, and like the tide. It changes with the seasons of your life. So let's map it. First, we have puberty, the chaotic opening act. Puberty isn't linear, it's messy, it's loud, it's emotional. It starts with the brain. The hypothalamus begins to signal to the pituitary gland, which then tells the ovaries start producing estrogen and progesterone. But in the early years, cycles are anovulatory, meaning ovulation doesn't happen yet, which also means no progesterone. So what you've got is a surge of estrogen with nothing to balance it. Cue emotional roller coasters, heavy periods, mood swings, breast tenderness, crying for no reason, bursts of rage or deep sadness, and zero coping strategies to handle it. Puberty is not just a psychological passage, it is literally biochemical chaos. Then you should, if you're lucky, reach the stable reproductive years, the Goldilocks zone if you're lucky. Once ovulation becomes regular, the body starts producing steady levels of progesterone. These are the years roughly about 20 to 35, again if you're lucky, where things should feel more balanced. The cycle length is typically 26 to 32 days. Estrogen will rise before ovulation, and progesterone follows to stabilize the mood, the sleep, and our emotions. And even here, many women don't get the relief they were promised because they're already depleted. So, birth control interrupts natural hormonal rhythms, and stress hijacks ovulation. Then throw in a few nutrient deficiencies, perhaps iron, B12, magnesium, and zinc, and they silently steal your resilience. So, even in the stable phase, many women live in low grade dysfunction and are told it's normal. Then we have poor females with PCOS, that's polycystic ovarian syndrome. So PCOS isn't really about cysts. It's a metabolic and hormonal disorder, often marked by high androgens, so those are testosterone and DHEA. Combine that with insulin resistance and irregular or absent ovulation. And then add in the fatigue, the acne, the anxiety, hair thinning, and weight gain that's completely stubborn and unexplained. Women get labeled as lazy, and it's totally disrupted hormone signaling, often from the brain to the ovaries. It's underdiagnosed, misdiagnosed, or worse, dismissed entirely. And then you have endometriosis, when the body attacks its own lining. So endometriosis isn't just bad periods, it's an inflammatory immune and hormonal condition where tissue similar to the uterine lining grows outside the uterus. It causes debilitating pain, horrific nausea, fatigue, bowel symptoms, pain during sex, fertility challenges, and then depression due to chronic inflammation and invalidation. So endo is deeply tied to estrogen dominance, and this often goes undetected for years. By the time the woman is taken seriously, the damage is done, emotionally and physically. There are some amazing consultants out there that are really, really good at helping people, with this condition, and I thank God for them. And then you have pregnancy, the massive hormonal recalibration. And pregnancy is the Mount Everest of hormonal states. You have estrogen and progesterone, they increase by up to 100 times. HCG spikes to sustain early pregnancy, then the thyroid speeds up, blood volume expands, and nutrient demand skyrocket. So it can feel euphoric for some women and exhausting for others. So many women feel emotionally raw, deeply connected, hypersensitive, and some, as I said, feel emotionally dysregulated. And then comes the crash, postpartum, the hormonal drop off a cliff. After birth, progesterone and estrogen plummet. This can feel like a deep dive off a steep summit. Postpartum blues affect up to 80% of women. So postnatal depression is really, really common but under-recognised. They've taken it out of the DSM-V now. And thyroid function can go haywire. So there is a condition called postpartum thyroiditis, and progesterone, it takes time to recover, and without it, sleep, mood, and resilience suffer. So this is not weakness, it's the biochemistry of depletion. Add in the sleep deprivation that comes with a little baby, identity upheaval that comes with it too, the physical recovery and the social isolation, and you have the perfect storm for emotional dysregulation. Next, we come to the wild decade, right? Perimenopause. And perimenopause isn't 1 year, it's more like 10. Usually begins after 35, 40, but can start earlier. So here is where ovulation becomes erratic. Progesterone drops first, years before the estrogen declines. Moods become more volatile, periods become heavier or vanish entirely. Anxiety returns or worsens, sleep fractures. Your poor libido fades and brain fog descends. You're told it's depression or stress, but what it often is a hormonal shift with no map, no support, and no language. And now menopause. Okay, the final frontier, the settling. So menopause is defined as 12 months without a period. The ovaries slow down, estrogen and progesterone reach new lows, FSH and LH spike. For some women, it's relief. For others, it's a reckoning. So there's vaginal dryness, loss of skin elasticity, an increased cardiovascular risk, bone loss, emotional disconnection, and sleep and temperature dysregulation. And yet, with awareness, support, and intervention, this can be a new dawn for many women, but only if you know what's happening in your body. So yeah, every stage of a woman's life tells a different hormonal story, and every story needs translation because biology and psychology are never separate. If we understand these arcs, if they're taught, if they're tracked, if they're tested for, and the right diagnostics are required, then people would stop misdiagnosing mood, medicating away symptoms, and gaslighting women. So if any of this speaks to you, you're not hysterical, you're hormonal, and that doesn't mean you're broken. You're very much cyclical and you deserve to be understood. So now that I've pulled the mask off misdiagnosis, let's step into the actual machinery underneath it all. So this isn't about turning you into some kind of biochemist, because hey, I'm definitely, not trying to overwhelm or, step into the role of a doctor here, as I said at the beginning. No, this is just about giving you some knowledge, leading you on a breadcrumb trail to give you your power back, because understanding what your body is doing will really, really help. And then you'll understand why certain things matter. Because the truth is, your mood is married to your molecules. So the menstrual cycle, it's not just about periods. Your cycle isn't just about bleeding. It's an orchestration, a complete symphony of hormones that rise and fall across 4 key phases. If that symphony is off key, you feel it. You really do. In your mind, your energy, and your emotions. So the phase of your periods, day 1 to 5, okay, this is when your bleed starts, hormones are at their lowest, you may feel tired, you may look inward, you might feel emotionally raw. It's not depression, it's biology. Progesterone and estrogen are both tanked, you're shedding the uterine lining, you feel yucky in yourself and your body's working really, really hard. Then you have the follicular phase. So day 1 to 14 overlaps with menstruation. Estrogen begins to rise again. This is your feel-good hormone, so mood lifts, your brain gets sharper, energy increases, creativity often returns. So your FSH is helping one follicle grow, so that's your follicle stimulating hormone, the one that will become the egg that you ovulate. And then ovulation happens, not always around day 14, right? So for some women, they ovulate early, some late, but the textbooks go around day 14. So estrogen peaks, so does LH, your luteinizing hormone. That triggers the release of the egg. Your libido spikes, you feel magnetic, motivated, and more confident. And if the egg isn't fertilized, estrogen drops and progesterone begins to rise. And then you have the luteal phase from day 15 to 28. Progesterone takes the lead. This hormone is calming, soothing, and supports sleep. If your progesterone is low, you'll feel irritable, anxious, sad, wired. Wired and tired is kind of like the energy of it, and unable to sleep. If the egg wasn't fertilized, that progesterone drop happens and the whole cycle begins again. So PMS, PMDD, anxiety, rage, cravings, and deep fatigue often happen in this luteal window, especially if progesterone is too low and estrogen is too dominant. It's a very delicate dance, the estrogen-progesterone dance. Estrogen, think of it as your motivator, your mood elevator, your skin plumper, and your joint protector. Progesterone is your anti-anxiety balm, your sleep support, and your anti-inflammatory. They need to stay in balance, and that balance is so easily disrupted by stress. Stress steals progesterone to make cortisol. Then you have nutrient deficiencies, zinc, B6, magnesium, and iron. Then you have your gut or liver issues affecting detox of excess estrogen. Hormonal birth control, that flattens the natural rise and fall of hormones. And then perimenopause, which leads to erratic surges and sudden crashes. So why do you need to know all of this? Because when something goes wrong, when progesterone crashes early, or especially if you're an early ovulator, or estrogen builds too high, or your body stops ovulating regularly, it won't just show up in your uterus. It'll show up in your moods, your memory, your sleep, your energy, your skin, your libido, your digestion, and your general sense of self and well-being. Hormones don't just run your reproductive system, they run your life. So if you've ever said to yourself, oh gee, I don't feel like myself, I'm exhausted but I can't sleep, I cry at random moments and then I feel totally numb. I used to feel motivated, now I just feel so flat. You're not crazy, you're not weak. There's nothing wrong with you. You might just have an out of sync hormonal cycle. You might be stuck in a hormonal chapter and you may never have even considered that you could possibly navigate your way out of it. So let's have a look at the hormonal chapters timeline. This is a whistle-stop tour. It's really, really quick through the hormonal landscapes that shape a woman's life and how they impact mind, mood, and meaning. So as I've covered these before, but this is, a different overview, right? So puberty, the hormonal rollercoaster that no one ever really explains properly. So you have the HPO axis, that's the hypothalamic pituitary ovarian axis. It's just learning how to drive. And just when you're doing your driving lessons, the car stalls, it revs, it overcorrects. So it's kind of messy. Periods may be irregular, heavy, missing, or painful. Then you're going to have these estrogen surges bringing about breast growth, mood changes. You can have oily skin, acne, emotional hypersensitivity. Progesterone often lags behind for a few years, and this is why teen girls often present as moody, anxious, overwhelmed, and then reactive. They don't have their biochemical buffer yet. And oh my God, my heart goes out to them. This gets labeled as attention seeking. That really makes me mad. Depression, anxiety, BPD. No, 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 no. And poor behavior. It could be at home or at school, and they can refuse school refusal. Add in a bit of bullying here, and you've got like a recipe for disaster essentially. So what's often missing is education, reassurance, nutritional support, and a long lens. Compassion is missing here, and that irritates me. I want that to be corrected. Then you have the settling phase, right? So late teens to 30s. This is when things should regulate, assuming the system is nourished, safe, and functioning optimally. You'll have regular ovulation beginning, estrogen and progesterone alternating in an elegant, sophisticated monthly rhythm, one would hope. Then you have your libido, your energy, and your mood. They may be at your most stable. PMS may show up here if there's hormonal imbalance, especially with stress, pill use, or nutrient depletion. Common issues at this stage to kind of focus on are hormonal birth control masking underlying issues, PCOS, endometriosis, often underdiagnosed, PMDD or severe PMS dismissed as just stress, and then you have pregnancy and postpartum transitions. So next we have PCOS. Oh, this one breaks my heart. Polycystic ovarian syndrome. Not just a fertility issue. It's a very complex endocrine and metabolic condition. So this often begins in adolescence, but can go unrecognized for years. And then people can be scanned and the cysts can come and go, right? So you don't need to have cysts for this to be polycystic ovarian syndrome. It involves insulin resistance, elevated androgens, and irregular or absent ovulation. The symptoms are weight gain, hair growth, acne, mood instability, extreme fatigue, a lot of anxiety, long cycles, or missed periods. And this gets labelled as depression, low motivation. There can be eating disorders as well here thrown in, not trying hard enough. It often needs blood sugar and insulin support. An anti-inflammatory diet here can do a lot. Some doctors will guide a patient on how to use magnesium, zinc, B vitamins, and inositol. You have to talk to your doctor about these. And it's all about cultivating hormonal literacy rather than shame. And then you have endometriosis, this horrific inflammatory condition where tissue similar to the uterine lining grows elsewhere. So this can start as well in teen years. It's often diagnosed in late 20s or 30s. So these ladies have suffered extremely painful periods, pelvic pain, digestive distress and fatigue for years often before this gets diagnosed. It's estrogen sensitive, meaning that excess estrogen and poor detoxification can worsen these symptoms. So it gets misread as IBS, hypochondria, low pain tolerance, depression, and what it really needs is serious pain management and medical support, hormonal rebalancing, of course, and gut healing and liver support, and not being gaslit by anybody. Then you have pregnancy. So this is the temporary high hormone state, often misunderstood as purely emotional or irrational. Progesterone skyrockets, supporting that uterine lining and calming the nervous system. Estrogen rises steadily, supporting fetal development. And then you have the fatigue, nausea, heightened emotions. Body changes are totally biological. The psychological impact of all of this is there is a huge identity shift. There's shifts in relationship dynamics. And then you have an unconscious resurfacing of maternal wounds. And this all happens usually before the baby arrives. Another thing that I see happen that really, really annoys me is frequent miscarriages due to estrogen dominance and deficiencies in progesterone. And for some reason in Ireland, this isn't, handled very well at all. It can be incredibly traumatic for women. I've seen women, you know, have needless miscarriages until they get the right referral, and this is actually, diagnosed properly for them. And it's quite heartbreaking, to be honest with you. Our country has so many deficiencies in healthcare, that I'm not going to pretend that I'm not angry about. I think it has to be said. And now, we have postpartum here, okay, the most dramatic hormonal crash a woman will ever face in her life. Often unsupported, very much misunderstood, the estrogen and progesterone plummet within days of giving birth. Oxytocin and prolactin will surge, especially if breastfeeding. There can be thyroid dysregulation, that's very common. You're going to have sleep deprivation that makes everything worse. And then incredible vulnerability to postnatal depression, anxiety, OCD, rage, and, rumination, intrusive thoughts. This is not weakness. This is not ingratitude. This is not failure. This is hormonal chaos on top of a possible traumatic birth, psychological upheaval, identity shifts, and shifts in your relationship dynamics. It's an awful lot for a woman to cope with. And then we have perimenopause, the 10-year window, as I said before menopause. So it's 10 years on average. So ovulation becomes less reliable, progesterone drops first, the estrogen swings wildly, too high one day, too low the next. You can still get pregnant while also experiencing hot flashes, anxiety, memory loss, and rage thrown in for good measure. So the symptoms here are heavy and irregular periods, breast pain, bloating, insomnia, mood instability, panic attacks out of absolutely nowhere, a sense of losing yourself. And most women aren't told this is perimenopause. They're told you're depressed, you're probably burnt out, have you tried yoga, are you meditating? So perimenopause is a portal, but you need a map to all of this. And then we have menopause, the official end of your reproductive years, about 12 months without a period diagnosis. There's estrogen and progesterone both flatline. Some women feel relief, others feel bereft. Symptoms may continue. You can have hot flashes, vaginal dryness, joint pain, mood shifts, sleep issues, low libido. HRT, if women choose it, can be beneficial. It needs to be a personalised discussion between you and your healthcare provider. Menopause isn't a decline, it's a new hormonal baseline, one that still requires nourishment, sleep, movement, connection, and meaning making. And then we have post-pill transitions, okay, coming off hormonal contraception. It can feel like your body's gone rogue, but there's a reason for it. What happens is hormonal contraceptives suppress ovulation, override your natural cycle, sometimes for years or even decades. So when you stop, your body may take time to restart its own hormone production. And this adjustment phase can mimic mood disorders or chronic fatigue. So common symptoms are acne, hair shedding, especially with androgenic pills, irregular or missed periods, mood swings, anxiety, low libido. You can have fatigue thrown in for good measure, breast tenderness, brain fog, PMS-like symptoms, they intensify. And it gets labelled as depression, panic disorder. You can often have post-pill PCOS as well, often misdiagnosed. So what's really happening is your HPO axis is waking up, and it doesn't always do so gently. So the body needs to relearn how to ovulate, it needs to rebalance estrogen and progesterone, it needs to restore depleted nutrients, the B6, the zinc, the magnesium, the folate. You're not broken, you're not going mad, you're recalibrating, rebooting. And I'm going to mention surgical menopause here as well, because this is really important. When menopause isn't gradual and it's immediate, for many reasons, health reasons, a woman may need to have her ovaries removed. And this can cause an abrupt stop in estrogen, progesterone, and testosterone production. And this often occurs during hysterectomies or cancer-related surgeries. And what's different here is there's no perimenopausal buffer. There's no gradual hormone tapering. There's an instant plunge into menopausal symptoms. And these symptoms are hot flashes, night sweats, severe insomnia, mood volatility, depression, loss of libido, vaginal dryness, joint pain, cognitive changes, and profound fatigue. The psychological toll is immense. There is grief over fertility and bodily integrity. We have identity shifts, and then throw in hormonal crash, surgical trauma. You have complexity within recovery here. Support needs often urgent HRT discussion with consultants and doctors, nutritional replenishment, emotional support around loss, transitions, and learning to become re-embodied and reattuned to the self. This is not just a normal part of being a woman. It's a very traumatic drop off a very traumatic cliff that requires softness, compassion, scaffolding, holding. And finally, I'm just going to touch on a very rare condition, but just in case somebody has experienced this, premature ovarian insufficiency, POI. So this is when menopause arrives far too early and uninvitedly, mind you. The definition of this really and truly is ovarian function stops or becomes highly irregular before the age of 40. So periods may stop completely, become very erratic, ovulation ceases, or it becomes highly infrequent. You have estrogen and progesterone declining long before midlife. The causes can include autoimmune issues, genetic conditions, chemotherapy or radiation, and unknown or idiopathic causes. The symptoms are missed or very spaced out periods. You'll have night sweats, hot flashes, vaginal dryness, fatigue, brain fog, mood swings, fertility struggles, osteopenia, osteoporosis risks at a very early age. And the emotional weight of this is very, very heavy. It often feels like a betrayal by one's body. There's a grief over lost fertility or the illusion of normal timelines. And extreme frustration at medical dismissal has come up in therapy, especially for young women who are told, oh, you're too young to be going through this. And treatment often includes hormonal replacement until at least natural menopausal age, and then, it can be revised, rediscussed with the consultant, with the doctor. These people do usually need a lot of psychological support. And, I've had a lot of referrals from consultants who, referred to me for that psychological support. And genuinely, these poor women, they need it, And then there is a need for nutrient and bone density monitoring. This is not rare, but this is routinely ignored. So we've just walked through the full arc of a woman's hormonal life, from the first bleed to the final one, from predictable patterns to the chaos of disruption. So if you recognized yourself in any of these outlines that I've given, or if you've been walking through symptoms in the dark, wondering why nothing makes sense, I really want you to hear this. You're not weak, you're not lacking resilience, you're not imagining it. Your hormones matter, your biochemistry matters, and the story your body tells you is worth decoding. So make an appointment with your doctor. Get every hormone tested on day 3 or 4 of your cycle, and then get your hormones tested on day 21 of your cycle, or if you're peeing on LH strips and you can recognize when you're ovulating, you can have them tested 7 days after ovulation. And next Thursday, I'll go deeper into the most misunderstood overlap of all, right? So I'm going to discuss in depth perimenopause, the depression, the anxiety, the emotional symptoms. They are often biological and, as I said, misdiagnosed as mental health issues. I'm going to cover this first because it presents the most frequently in therapy. And if you've been misdiagnosed or misheard or missed entirely, trust your body, track your cycle, bring your data. Knowledge is power. When you bring your data to the doctor, they can't do anything with no data. So map it, track it, a copybook, an app, whatever works for you. Type it on your laptop, type it into a notes app on your phone. but collect your data every day. Do little check-ins, set reminders on your phone, do the check-ins, map it. Another really good thing to do is, to take your temperature every morning and map that also. Notice any, changes in vaginal secretions, map that also. So all of that data can help the consultant or the doctor that's actually going to treat you help you. It's essential. And this helps you advocate for yourself. So tomorrow, drop back in where I'm going to outline identification with the aggressor. And there'll be another Freud Made Me Do It episode on somaticization on Saturday. And then one that is misinterpreted online the whole time, a deep dive into gaslighting, another Freud Made Me Do It. We'll have a movie mirror episode on Monday, the mistress or other man mirror on Tuesday, and an episode on I'm Just Not Ready on Wednesday, and tune back in here next Thursday for that deep dive on perimenopause. And again, this is for educational and informational purposes only. I am not a doctor, I'm a psychotherapist. This is not medical advice. You're responsible for your own health. Please consult a qualified doctor or consultant to help you, and please advocate for your own treatment. I just want to give you various options to help you make informed choices with informed consent. If this episode helped you, share it with your friends, share it with your sisters, share it with the other females in your life that absolutely come to your aid every month when you're feeling a little bit slumpish at that time of the month. The sisterhood understands this. So share it with a friend. Hit follow so you don't miss the notifications of new episodes. And I'm Annie from Path Alchemy. It's been my pleasure, and I really hope you have a fabulous day. Bye for now.